Your doctor has ordered the GI Effects 3-day stool sample collection kit. You'll see the contents of the kit outlined here on the table. We'll start by referring to these bags here, which will be your collection bags. You'll see the first 2 days look exactly the same. We have this green container here with a pair of gloves and a paper towel. What you're going to do is you'll take one of these paper boats here and you'll have a bowel movement in here. What will happen is you'll have this, piece of stool that's in here. You'll take these containers, open it up. There's an attached spoon that you'll probably not be able to see super well in this video here, but once you open up that container carefully, you'll see there's an attached spoon attached to the top of this green lid. You'll open up that container using that spoon. You'll take a piece of the very first part that came out and put it into this container. You'll take a piece of the middle part that came out, the middle part of the stool, and put it in this container, and the last part or the end of the stool that came out, and you'll put it into this container. Once that is collected, you're free to dispose of the rest of the stool and throw that container away. Once those 3 portions of the stool are placed into this bag here, you'll screw that cap on nice and tight, making sure that the threading of that cap with the vial itself is nicely formed together, so you get a nice and tight seal. You'll mix it to shake, so just shake a couple times, and you'll label with your name. The ID number is your date of birth with the month, day, and year, the date that you collect and the time that you collect, as well as what the stool looked like, so anything from formed to watery, loose, or soft. You'll make just one little X there. Once you're done, you can dispose of those gloves. Like I mentioned, dispose of this paper boat with the stool that's remaining in there. You're welcome to use one of these black bags to put that into your garbage can. And you'll have this remaining labeled, tightly sealed vial in this biohazard bag here with that paper towel meant to collect any sort of liquid that might drain from there, which we don't anticipate on happening. It's extremely important that you seal this tightly. You'll seal this bag up just like a normal Ziploc bag, get all the air out of it, and then place into the refrigerator. That's the end of day 1. For day 2, same situation. So you'll take this bag labeled day 2. You'll see there's another green vial in there. You'll have another bowel movement into these paper boats. You'll open up this vial. Important to open up that vial on a flat surface. Tap the top of the lid to get any of the liquid that might be hanging out at the inside top of that lid, just to prevent any of the liquid from being lost in transmission. You'll open up that vial, like I mentioned. You'll take that beginning part of the stool, put it into the vial, middle and end, just like you did on day 1. And then same deal, making sure that it's nice and tightly sealed. You'll label with your name. The ID number is your date of birth in month, day, year format, the date and the time that you collect, as well as what the consistency of the stool look like. You'll make sure this cap is nicely twisted on tight. That paper towel is included to catch any sort of drippage that might happen, which we don't intend on happening. You'll take these pair of gloves that you used to handle the stool and throw those away, as well as the remaining piece of stool, that paper boat, and another black bag. There. That second day stool sample will go into your fridge with the first day. The third day is a little bit different, a little more involved. You have a couple other things to do here on this day. It'll start out the same way, where you're going to have a bowel movement in this paper boat here. You'll take that pair of gloves and put them on your hands, and then you'll separate that stool into 5 different components. So what we see here, we have these 4 different vials, as well as this swab with a smaller vial. You'll use each of these little tubes here. You see this green one that you might recognize from the first and second day. They all have little spatulas or little spoons attached to the top lid. So you'll open up the container on a flat surface, making sure that you tap before opening to drop all the rest of that liquid that might be hanging out. You'll take the beginning, the middle, and the end portion again to put it into this container. Whoopsie. And you'll twist it on nice and tight, labeling with your name, date of birth, date and time collected, as well as what the specimen looked like. You'll repeat that for each of these guys here. This looks exactly the same, it's just a different cap, including all of that information there. And then again with the orange cap here. With the white cap, you'll notice that there is no liquid included in here. Your kit might look a little bit different where there's a larger white cap vial. Same deal, you're just going to use just the little popsicle stick that might be included in that kit to collect the stool. Same deal, beginning, middle, end. Being careful not to fill it past this red line here. The last portion of that day 3 is using this, what we call a fecal swab. I'm not going to open this, but I'll just kind of demonstrate what you'll do. When you take this out, it's going to be, stool is already in this boat. You're ready to transfer it into another vial. Don't open it before then. You'll take this little orange tube out and place it standing straight up on the table, making sure that all of that liquid has fallen down into the bottom half of the cap. And then with a gloved hand still, you're going to take this plastic little Q-tip looking thing and put it into the stool. Any portion of the stool is fine. You're going to just take a little swab. You're welcome to also do the beginning, middle, and end portion again into this container. And you won't fill it anywhere past that black line here. Once all of the stool has been added into that, not reaching past that black line, you're going to mash it down and mix it using the side of the vial for help with mashing that down. And then what you'll do is you'll include this swab in the container. So the way that you're going to do that is you're going to put it down. That little cotton piece will touch the bottom end of that vial. And then you'll see this red portion here. That red portion should line up almost perfectly with the very top of that vial. What you're going to do, you'll see this is a little bit bendy. When that little swab is inside this vial, you're going to bend the stick. It will break at that red spot. This top portion can just be thrown into the trash. This bottom portion will stay in here through transport. You'll then put that orange lid on top of there and twist it on nice and tight. Labeling again with all that same information with your name, date of birth, date, and time collected. You might have to just write really carefully, really legibly here so the lab folks can see it. Once you're done with that day 3, everything's going to go into the refrigerator just like you did with the first 2 days. This one won't be in this baggie here. It'll be just this vial with that second half of that cotton that's in there, but you can place it into that biohazard bag. Those pair of gloves, and again, this boat with the black bag can all be tossed out in the trash. Everything making sure that it's all labeled, clearly, legibly, that you selected what the stool looks like. Everything's correct on there. You're going to seal it just like a Ziploc bag, get all that air out, and then place it into the refrigerator. The following day is when you're going to ship it out. So what the ship is going to look like is I'll kind of move some of the stuff that's going to be into the garbage. This purple form here is just some information on some shipping instructions. You're welcome to read it, but you do not need to include it. These are some stickers for your date of birth if needed. If you run out of room for whatever reason, they peel off just like so. You're welcome to just stick those on the vial if you need to only. There are places like I showed you that have the date of birth ready for there, so you don't need to use these if you have enough room. If you don't need them, throw those away as well. This is a little patient, just a survey that they use for their testing information, all the lab results, making sure that you fill this out to the best of your ability and include it when you ship everything out. So you'll include this, you'll include all 3 bags that had been previously refrigerated. We'll pretend that this is in day 3's bag. You'll open up the box just like so. Does not need to be shipped on ice. Everything will be refrigerated beforehand, but does not need ice. Everything will go in here just like that. And then you'll seal the box. This paper requisition should have your physician's signature as well as the selection of who is ordering this for you. You will complete this portion of things with the month, day, year of the 3rd day that you collect, what the consistency was and what the color of the stool was. So do not forget this portion of things before submitting out. Everything else will be selected and filled out for you. So just verify that everything is spelled appropriately and your address is correct. The bottom half of things here is where you'll make sure that you have signed, printed, and dated, just indicating that you're responsible for the payment of this test kit. Genova will bill you directly. You will not be charged for this test kit at the time of your visit. You will receive a bill in the mail from Genova. Depending on if you have insurance or if you're choosing to use insurance, Genova will run that payment through your insurance first, and then you'll receive a bill once that payment has been processed. If you're using cash pay, they'll just directly bill you for that credit card amount. This completed requisition will slip into that top pocket just like so. You'll open up this included FedEx bag. You'll see this little square that's here. You'll take this little adhesive sticker off just like that and stick it on there to indicate where it's going. You're welcome to put your return address just there. And then you'll put this box into this bag, making sure that there's no air in it, and just do it like that. And then you'll take this little red piece off to seal it together, and then you will ship this out through a FedEx. Either call them to pick up directly from your home or send it to a FedEx location. In order to properly prepare for this test, make sure that you are avoiding any probiotics or digestive enzymes for 2 weeks prior to collection. If you're unsure if you're on any of these things, please reach out to your provider and ask them. Also, you should not be taking any antibiotics during the time of collection, as all three, the probiotics, the digestive enzymes, and the antibiotics, can interfere with results. We want to make sure that we're giving you the appropriate, reliable results in the end. If you have any questions, please do not hesitate to reach out to your provider or front office staff.